Are we ready for tonight? For tonight's discussion, we want to talk about egg quality and egg quantity. Let's look at the details. So if you are ready, talk to me in the comment section. Just type ready. If you are coming for the first time, make sure you are following me. Tap on your screen, share the live. If what I'm saying make any sense to you at all, drop a heart me. That's the only way you can support this live stream, right? All right, let's talk about this. Egg quality and egg quantity. Yeah, and we're going to look at why more eggs is not always the determining factor. Right? Why? Because this whole number game can be misleading. Oh, I still have enough eggs. Oh, I have less eggs. Oh, I have that number of eggs. One of the first things many women hear during their fertility evaluation is your egg count is good. Isn't that so? Those of you that have done some of these tests, what do you hear? The first thing you say, oh, don't worry, your egg count is good. Or you hear things like your egg reserve is low. Right? Thank you for the follow. I'll follow you back. So is it that your egg count is good or your egg reserve is low? If you're trying to conceive, you've heard one of these things I'm talking about. And naturally, this leads to a simple assumption that more eggs will mean better chance of pregnancy. Right? It sounds logical. You're trying to conceive one Libra queen. You're trying to conceive. Don't worry. You need knowledge. What you need is knowledge. I know somebody is here looking for one drug that will change the story. Sorry. All the 14 people that have been pregnant this year, we didn't give them drugs. It is a drug of knowledge we gave them. So 6 more people waiting. So we'll put your name in that number. Right? So if you hear things like more eggs is equal to better chance of pregnancy, that sounds logical. It does. But here's the truth, right? The truth that actually changes everything. Egg count and egg quality are not the same. Right? They're not the same. And they do not affect fertility in the same way. Yeah? So now let's go into the gist and look at the difference and how they apply. Right? So who is ready for the gist? Leon is here. Who's ready for the gist? Type in the comment section ready if you're ready for the gist. We'll start with egg count. Egg count. Because that is the one that is first to be mentioned. Egg count. We'll start with egg count. Please tap on your screen. Don't keep this information. It's for everybody. Right? The more you tap, the better chance those people who are trying to conceive will find us on TikTok. Is that okay? So just help us reach them. That's what we are saying. All right? So what is egg count? What is egg count? If you're just joining, you're welcome. What is egg count? In the simplest possible term. Hi, Adasa is here. Thank you very much, Adasa, for the heart me. I hope your day was good. Daughter of Zion is here. Wow, good to see you. Thank you for the likes. Thank you. In the simplest possible language. Thank you for the rose. I appreciate you. Right? In the simplest possible language, what is egg count? It refers to how many eggs remain in the ovaries. And this is also called ovarian reserve. I know you've heard that one very many times. So, but why do we define it this way? Why do we refer to egg count as per what is remaining? What does that language suggest to you? Egg count, amount of egg remaining. What does that suggest to you? Of course, it will suggest that the number is finite. Oh, English language. Oh. Okay, some people say finite, finite, or whatever, depending on where and who taught you English. The number is not continuously increasing, rather, it is decreasing. Now, this is the idea. Every woman born into this world was born with a specific number of eggs. Women don't produce eggs like men do. Men produce sperm, 1,500 cells, about that number. 1,500 cells per second. Right? So for every second I'm here talking, 1,500, 1,500. So at the end of the day, a healthy man, right? A healthy man would have produced more than 100 million sperm cells at the end of the day. So men produce sperm cells on the go. See why they always want to knock? There's got to be somewhere to send it to, right? Oh boy. I know, right? But it's biology. It's biology. If you're just joining, you're welcome. Make sure you're tapping on your screen. But women, when the baby girl is born, she was born with definite number of eggs. That number does not increase. Unfortunately, the number decreases geometrically. Well, if you don't know what geometrically is, what I mean is that it does not decrease one every month. No, it does not decrease like that. In a month, you can decrease by 10. Another month by 8. Another month by 2. That is geometric cut down, right? Oh boy, are you understanding anything? If you're here, you're understanding something, just type understand. Let me be sure I'm not talking above your heads, right? I want to be sure that we lay the foundation, because this will form the basis for everything we're talking about tonight. If you miss this information, I cannot help you. You can get up to 40 years old and say, why am I not getting pregnant? This is the information you need. This is the information you need. You want to understand the basis for fertility. Otherwise, you spend money everywhere in the world is the same. You will spend money. And no doctor has the time to sit you down and be explaining these things to you. So now you have the opportunity to hear it. Learn it now and face your journey with peace of mind without worry. Thank you, Chrissy, for the follow. Right? So I was explaining that when a baby girl, thanks, Okay. So when a baby girl is born, she is born with definite number of eggs, anywhere around 1 to 2 million eggs, right? She was born with it. Like we will say here, it is follow come, right? It is follow come eggs. Yes, you must get pregnant this year, Egbe, Miracle, and Princess, right? You will get pregnant. Put your name on the remaining 6 people that will get pregnant before June, because we will meet that number and we'll surpass it. I tell you the truth. So where was I? So the baby girl is born with definite number of eggs, about 1 to 2 million, right? Now, as she grows, by the time she hits puberty, she has lost 1/3 of that number. What happened? What happened? That is biology. By puberty, she has already lost 1/3. 1/3 of 1 million is gone. Then from puberty, she starts shedding. Christy LaBelle is here. Hello, Christy LaBelle. Yes, thank God it's Friday. I remember this Friday is Black Friday for knacking. So if you are not going to knock, leave the live stream. After the live stream, knocking, go and knock with you no good. Anyway, where was I? So I was talking about eggs. And by the way, if you don't like to hear knock, this live stream is not for you, because in this live stream, after the live stream, you must knock. All right, where was I? So by the time the baby girl gets to puberty, 1/3 of that number is lost, and it will never be recovered again. So the remaining 2/3, every month she sheds this number, that number, every month. So that remaining number does not add up, rather is lost per month. By the time the woman gets to 30 years, imagine how many of those eggs are already gone. More than half of what she was born with is gone. Not more than half. Less than 1,000 will be remaining at that time. Less than 1,000. So from 30 years, fertility begins to decline because of this reason. Why? Egg count is drastically reduced at that time, right? But remember, egg reserve is not the same for everybody. So some people can have more, some people can have less. Even people in their 20s can even have less number of eggs, just by reason of how they were born, right? So it's not really their fault. It is what it is, right? So I said all that to explain to you that egg count is a function of the amount of eggs remaining in the ovaries, and that suggests to you that the number does not increase. The number does not increase. There's a geometric cut down every month. So as you are listening to me now, at the end of this your current cycle, good number 4 to 8 would have gone. Then wait for next month for another category, for another number to cut down. So it's a continuous thing, right? So by the time you hit 35 years, another factor comes into play, and that is the factor of quality. Egg quality begins to depreciate from 35. So now, double trouble, right? Is it not double trouble? Ovarian reserve is going down like this. Quality is going down like this. That is the reason why fertility is usually delayed or difficult for those 35 and above. And even when they get pregnant, there is a high risk of miscarriage at that age. So when is the right time to start trying? Today is the right time to start trying. You got to understand how your body works. You have to understand how biology works. Biology is not by emotions. Biology is not by God will do it. Religion. Because religious people can say a lot of things, right? Biology is precision and timing. The older you get, the lesser the chance. It's not your fault. It is biology. Is that okay? So I said all that to say that egg count refers to how many eggs remain in the ovaries, otherwise called ovarian reserve. That is all I've been trying to say, right? So how is this measured? How is this measured? Why should I check my own? Okay, I cannot check your own on the live stream, but by the end of this live stream, you will know how it can be checked. Is that okay? So just keep listening. Just keep listening. All right. So where was I? How can this be measured? How this ovarian reserve, how it is measured? Now, doctors estimate egg count using blood tests like AMH. If you have done hormonal profile test before, you've heard this before. AMH. What does that even mean? It means anti-Mullerian hormone. That's what it means. But don't worry about the big grammar. Just know that there is a test you do to measure your ovarian reserve, and that is AMH. A for apple, M for man, H for hormone. Right? Ifeoma, what are you laughing at? Right? So besides the AMH, ultrasound also is helpful. What does ultrasound do? They check for the antral follicle count, AFC. Right? Don't worry about the details. Just know that these are the things. You said I'm so funny. Right? Don't bother yourself about the technicalities. Just understand that you understand the principles, and that will help your fertility journey greatly. Good evening, son of Jacob is here. You're welcome. You're welcome. Right? So that is how it is measured, right? So when it is measured, what does it tell you? What does this ovarian reserve, when it is measured, what does it tell you? Now, when you do that AMH or you look for AFC, that is an antral follicle through ultrasound, it tells you how many eggs are available. So your doctor looks at that test result. He has an idea. This is what is happening. So those of you that are close to, let's say, 35 years and above, it's important you understand what I'm saying. For some of you are still very much wasting your time, spending a lot of money. Right? I'm still looking for opportunity to gather all the 35 and above that are trying to conceive, so that we would let us advise ourselves, right? You've got to move past this your natural trying. You will spend money tire. All right, let me not deviate, but I'm concerned about you. I'm really concerned about you. So I was saying that these tests, AMH through blood tests, AFC through ultrasound, what do they tell you? What the egg counts, what do they tell you? Number one, they tell you how many eggs are available, right? Number two, they tell you how the ovaries respond to stimulation. Because some people's ovaries are not responding to stimulation. Right? The hormones are okay, but it's not enough to have hormones. Is the ovary responding? When we knock, pom, 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 is the door going to be open? Who is understanding anything? I want to be sure. Oh boy, because if you miss me, you may never be able to catch me up until December. Right? So that is what the tests will tell you. But what the test will not tell you, because I like to make sure we put all the cards plain on the table so that you decide how long you still want to be trying and wasting your time. So that is what the test tells you. It tells you how many eggs are available. It's still there. But what does it not tell you? So that you don't now put your hopes in wasting your time and doing other things. Right? What egg count does not tell you it does not tell you whether the eggs are healthy. It does not tell you that. It cannot tell you that, actually. It cannot tell you whether they can be fertilized. The test will not say, okay, this egg will be fertilized. No, it's only telling you what is remaining, what is available. Whether they can be fertilized, whether they are healthy, no, it cannot say so. Right? Beloved is here. Stacy Padula, I see. The tests will not tell you whether they can lead to a successful pregnancy, no. But what does the test do for you? It tells you how many eggs are available. It tells you how the ovaries are responding to stimulation. That's what it's telling you. But whether the eggs are healthy, it cannot tell you that. Whether the eggs can be fertilized, it cannot tell you that. Whether they can lead to successful pregnancy, it cannot tell you that. So, good. The results are okay. AMH, adequate. AFC, good. We now know what the tests do, and we know what it does not do. Now, that is where the question of egg quality comes. Because it's not enough to have good number, good reserve, ovarian reserve. It's not enough. Are the eggs of good quality? Because it is the quality that will determine successful pregnancy. Right? It is. So what is egg quality anyway? All right, before I continue, please tap on your screen. We are close to 40 people. We are still 5K likes. That is not fair. Right? That is not fair. You are not following me. You are not tapping. You are not dropping a heart to me. That is not fair for the help we are trying to help people around the world. You need to tap on your screen. Not for me anyway. I already they knock, they get picking. So it's for you and others that are trying to conceive. Let's help people, right? Let's help people. All right, please tap on your screen. By the way, coming soon, for those that are trying to conceive, there is something coming up that's going to help you. It's going to help you with all the knowledge you need. Very soon we'll unveil it, and I'm sure you will take advantage of it wherever you are in the world. All right. So let's go on and talk about what egg quality, what egg quality is. Right? We know what ovarian reserve is. Right? We know what ovarian reserve is. So what is egg quality? Okay, in simplest possible term as usual. Egg quality refers to how healthy and genetically normal the egg is. Quality with respect to egg is how healthy and how genetically normal that egg is. This determines the ability. It determines the ability to be fertilized. Quality egg will determine whether this thing can be fertilized or not. It determines the ability to form a healthy embryo. It's not enough for fertilization to take place. The embryo that comes out of that fertilization, is it healthy? Is it a quality embryo? And it also determines the ability for this fertilization embryo to turn out to become a successful pregnancy. Because there are several pregnancies that were dead on arrival, right? Dead on arrival. Fertilization took place, but pregnancy still did not happen. Why? For many reasons I've talked about in the past. So if you are just joining for the first time, make sure you tap on your screen, share the live, follow me. And if you have missed anything I've said in the past months, because we started this since January, go to YouTube, search my name, Dr. Godwin EMB. Especially if you are a man, you want to know how to produce precious sperm. I've taught the men here how to produce precious sperm. And I advise women, demand precious sperm. It is your right. Demand it. Whether you are trying to conceive or you are not trying to conceive, demand it. It is your right. Right? Because if you know what is in that precious sperm, when I say go and knock, you will not hesitate. Anyway, so go to YouTube. Dr. Gordon EMB is the name. Search any topic you are looking for. It should be there, including today's topic. The videos are there. If you would watch those videos, do what we ask you to do. Pregnancy is 80%. You cannot miss it. Right? You cannot miss it. All right, so back to our gist. We're talking about egg quality, right? And I said egg quality determines the ability for the egg to be fertilized, the ability. Delphiatot said, "Hi, doctor. I have 22-year boy. I can't fall pregnant. Then go and do IVF now. Why are you wasting time? You already know what the problem is. At least you know. Do IVF, bypass the blocked tubes, carry belly and rest." A good question, Adasa. I will come back to that. I pray I remember. Please, somebody should remind me of that question. Even if Adasa is not here, we should answer that question. It's a very important question. Please, somebody should remind me. Right? So where was I? Yes, somebody should remind me of this question. So I was saying that. Fine shoes. Your matter we'll get to you shortly. When it's time for question and answers, we'll get to your question. Very interesting question too. Anyway, so I was saying that quality eggs will determine whether the ability for the eggs to be fertilized, the ability for them to form healthy embryo, the ability for that process to amount to a successful pregnancy. That's what I said. All right. Now, what is the difference between these two? Egg quality, egg quantity. There is a critical difference. Egg count as ovarian reserve is quantity, right? While egg quality is functionality. Yeah? I'm saying all that. I'm looking at the comment section. Don't worry, we'll answer all those things. Now, you can have many eggs, but poor quality eggs. Yeah? Or you can have few eggs, but good quality eggs. Is that clear? So we know what quantity is, we know what quality is, but again, understand that it is possible to have many eggs, but all that many eggs are poor quality eggs. It's possible to have few eggs, but that few eggs are quality eggs, right? So these what I just said now will lead to different outcomes for different people. That's why you cannot use somebody's testimony to determine when you are going to get pregnant. No, you cannot do that. We need to pursue your own case to a logical conclusion. How do you detect it? You are just coming, Casey. You're just coming. So follow me, share your life. If you miss anything I said today, go to YouTube. It will be there by tomorrow. Go to YouTube. Learn. If you would watch those videos, you will be pregnant for real. Right? So I said quality and quantity will determine the different outcomes that you see in different people. So you cannot use somebody's testimony to determine when you are going to get pregnant. But I'm telling you today, if you listen to what we're telling you, you will get pregnant. You will. Right? Now, this is the reason why egg quality matters. Right? You see, fertility is not just all about releasing eggs. It's not just all about releasing eggs. It is about releasing eggs that can combine properly with sperm. Now, if you go to my profile, there are cartoons there that talk about these things, right? Very funny ones. Right. Some eggs are just impenetrable, right? So, sperm is available, but some eggs are just impenetrable. They are shakara too much. Right? So now, even if they were penetrated by sperm or fertilization did take place, it's also a function of that union to divide correctly. Whether it divides correctly and develop into a healthy embryo, that is what will determine the fertility. Remember that the body has a quality control, quality assurance process or system that checks this fertilization that has happened. And if it does not meet the standard, it will be deleted. And many of which is the miscarriages you are concerned about. Why? Because poor egg can lead to failed fertilization. Poor egg can lead to failed fertilization. Right? Yes, Christy LaBelle. Women are like eggs. Shakara too much. Right? Poor egg quality can lead to failed fertilization. Can also lead to poor embryo development. And poor embryo may not stand the chance of continuing as pregnancy because the body has a quality control system. It will look at the DNA of that thing. Is this going to produce for us a quality human being? If the answer is no, it will delete it. Right? So if you're hearing that for the first time, hear it very well. Right? It can also lead to implantation failure. Why? Because everything needs to be in the proper order for the interaction between the embryo and the uterine wall. Some details I cannot give you because I'm talking to a general global audience who are not medics or scientists. So there's some things I cannot tell you. But the one way you hear, manager like that. Right? So poor egg quality, I said earlier, will lead to miscarriage. It will. So we cannot afford to have poor egg quality. Right? We cannot afford to have poor egg quality. Well, now that brings us to the elephant in the room. Right? The biggest factor in egg quality, the biggest. Who's ready to hear this? The biggest factor in egg quality. Who's ready to hear? Only those who want to hear will just gather in one place and whisper in their ears, right? The biggest factor. And it's going to disappoint many of you. But don't be disappointed. There's got to be a way, right? There's got to be a way. All right, 3 people are ready. Ready to hear the biggest factor. Good evening. Lady G is here. Hello, Lady G. Good to see you. If you're just joining, you're welcome. Tap on your screen, share the live. If you are trying to conceive, I would advise that you follow me. Follow me. Right? Because we need to change your story, right? We need to change your story. So, somebody said, may God give woman husband early. Amen. Amen to that. I agree with you. Husbands, where are you? Why are there so many men, but there are few husbands? Why? Why is life like this? Why? Right? Fine shoes, you have to wait. When it's time for Q&A, I'll answer you. Is that okay? Why are there so many men who can knock, but few husbands? So husbands, show yourself. Okay, where was I? How did I get there? How did I get there? All right, so I was saying, I was going to talk about the biggest factor in egg quality. Right? Now, egg quality is strongly linked to age. That's disappointing. That's disappointing. Egg quality is strongly linked to age. What does that mean? The older you get, the lesser the quality. Right? Why? Because, women are born with all their eggs. All. eggs are follow come. They don't produce eggs like sperm is produced. So the eggs they have now, they've had it all their life. It has always been there. So if you are 40 years old, your egg is 40 years old. If you are 50 years old, okay, maybe the thing will not finish by 50. Right? If you are 26 years old, your egg is 26 years old. So women are born with all their eggs. And over time, the egg will age. It will age. And aging comes with DNA integrity declining. And that is the key behind quality. Right? And with all this decline of DNA, integrity, quality is declining and all that, there comes the risk of abnormality. The possibility of giving birth to a child with abnormalities increases with age. It does. So you begin to see why this fertility thing is of serious importance to talk about. Right? Especially with age, which is the biggest factor. Right? Now look at this. Under 30 years of age, those in the age bracket 30 years, the egg quality is higher. In fact, in your mid-20s, that is the optimum level of your quality of eggs. But with all the career pursuing and all that, would you think of even having kids by that time? Tima Karim, you're welcome. I see you. Right? Because when the egg quality is optimum, that's when we're pursuing career. And which one example do you have in the world today that pursued career as a woman and succeeded in her 20s without help from anybody? Even the ones that have help, when did they achieve anything? Right? So you can see it's a trade-off. It's a trade-off. So under 20, you have high quality eggs. 30 to 35, there's a gradual decline in number from 30. Then by the time you hit 35, quality begins to decline too. 35 plus, the decline is more noticeable at that time. Then 40 and above, there's a significant decline. Does it mean you cannot get pregnant? You can, but with some difficulty. What would have taken you 6 months, you don't reach 5 years, you are still trying. Right? Why? Because of age. It does not mean that you don't stand a chance, just that your success rate has reduced. Even with assisted reproductive technology. So that's why we call it trying, right? That's why it's called trying. Now, with all that confusion, the confusion still doesn't end, right? There are young women with low egg count, right? Low egg count, fewer eggs, but often the quality is high. Such individuals, pregnancy is still possible. Right? Why? Because even though the egg count is low, that egg can come out at all. It's a good quality egg. So the chance of pregnancy is still there. Right? Older women with higher egg count, they may have many eggs, but lower quality. but lower quality. Pregnancy may happen, but it will be difficult, right? Pregnancy will happen, but it will be difficult. So it's not all loss, but just understand that it will come with some difficulty, whichever way you want to go. But again, let's go to something interesting. But before we go to something interesting, please tap on your screen, share the live, call those you think needs this information, especially those that are trying to conceive, because they will benefit from it. All right. I want to talk about the conditions that affect egg count. Who's ready for that gist? Please, I need to see you talk to me in the comment section. Who is ready to hear about the conditions that affect egg count? We've talked about age. Yep. So let's look at other conditions. Age is not a condition, it's just biology at work. Conditions. Yeah, because it's not the same for everybody. Queen Sino. It's not the same for everybody. Right? There are outliers, exception to the rules. There are people in their 20s, mid-20s, that it's difficult to be pregnant. These are outliers. That's exception to the rule. Right? Nico, we need to check your test. You need to be evaluated. That's how we can know. All right? There are those in 50s that are still giving birth, right? Giving birth. These are outliers. Menopause refuse to go away. And they are still knocking, no time. Right? So these are outliers. But the rule, the average individuals are all in one place. And that's what we're talking about. So you cannot say, because Mama Nkechi gave birth when she was 55 years old, therefore such is your case. Sorry, such cannot be your case, because you are not the same. You are not the same. Your ovarian reserve may not be the same. The speed of decline of quality of eggs will not be the same. Right? All right, let's talk about that condition. The conditions, rather, that affects egg count. Right? Let's talk about this notorious guy. I told you I'm going to talk about this in detail next week. Notorious polycystic ovarian syndrome. Right? That is the first one. First condition that affects egg count. Right? Here you often have high counts, but ovulation and quality may be affected. It's not when the thing is ovulated before it can be, right? Before it can be fertilized. Even the quality becomes poor because of several other things that are part of the problem. Right? So that is condition number one, polycystic ovarian syndrome, notorious PCOS. And the other one we talked about, which is the ovarian age. How old? If I told you if you are 50 years old, your ovaries are 50 years old. So you are dealing with older eggs. Right? Please tap on your screen and share the live. Tap on your screen, share the live, and if the information you are getting is of any value to you, you may want to drop a heart me. That is the way to support the live stream. Right? And if you're just joining, make sure you follow me. Follow me. That's the way to go. Right? Now the third thing is thank you very much for the rules. There are some people in cases of surgery or medical treatments. These are also conditions that can affect egg counts, right? Because surgery or some medical treatments may reduce ovarian reserve. That's why I remember one time, I think we're having some discussion of people who want to go for maybe chemotherapy or something like that. Yeah, usually you advise them, if you still want to have kids, you want to freeze your eggs, then after your chemo, you can. Why? Because chemo will fry those eggs and you may not have anything. So, Mr. Tabs is here. I see you. Right? So these are the things that affect the egg count. There are also things that affect egg quality. Right, Mr. Tabs? Okay, yeah, I just saw Mr. Tabs. Just a quick one. If you are a business individual, you do business online, you render services, you whatever you do. And I always advise people, if you're on platforms like this, showcase yourself. Use your account to do your business. Don't go and be wasting time and be shaking, waiting no good. All right, so this account, Tabs Mobile, that community, we are having business week where you showcase your services, your business for a whole 1 week live on TikTok. So you want to grab him, you want to register. Registration is free anyway. Showcase your business and make your time on the app. Make it make sense. Don't just be there doing only God knows what. Right? All right, let's talk about factors that also affect egg quality. We just talk about egg quantity. Let's talk about egg quality. And age is the first one, like we've mentioned earlier, and is the most important factor. Thank you, Mr. Tabs. I appreciate you for the Go Popular. Thank you. Age is the first one. The second one is oxidative stress. This is a damage that comes from free radicals, right? And these free radicals affect cells. Like their name, they are radicals, right? They affect cells. And that is why they will advise you eat food that are rich in antioxidants, which will antagonize the effect of the free radicals. Is that okay? So that is the second thing. The third thing is lifestyle. You want to make sure your egg quality is optimum at all times. You want to leave smoking. Wherever you are in the world. I know that Europe and America, women, it is fashionable for women to smoke, right, and drink. It is not fashionable everywhere else, because in this society, yes, women smoke and drink, but the problem is they hide it because it is, so there's societal difference in these things. So such lifestyle for a woman is not right with respect to her fertility. Smoking, no way. Stop it. Drinking, alcohol, reduce it. For me, I would say stop it altogether. And poor diet. These lifestyle patterns will affect egg quality. Right? It will affect egg quality. Right? Hormonal imbalance too. It will affect egg maturation. Why? Because For egg to begin to mature in the first place, you need interaction of hormones to make that happen. So hormonal imbalance will affect egg maturation. And the one I'll always say time and time again, this one, we do it ourselves. The environment does it to us. That is the environmental exposure to toxins, right? Which will affect the cellular health. Whether it's the one you are spraying as deodorant, perspirant, whatever those things are, the ones you rub on your skin, your face, your lip, your hair, and all those kind of things. Toxins, right? This will affect cellular health, and it will affect your fertility too, right? If you are still here, talk to me in the comment section. Just type, I'm here. Let me be sure you're still there, right? All right. Oh boy. I tell you, by the way, today is Friday, and if you have been here, today is Black Friday for knacking. After the live stream, make sure you go and knock waiting no good. Especially for those that are trying to conceive. If you know knock, not come and be asking me questions. Doctor, do nothing. Doctor will not help you to knock. Go and knock, right? So go and knock waiting no good, right? So it's a marching order. I'll answer your question. Just relax. In few moments now, I'll answer your question. Whether you're ovulating or not, right? Whether you're ovulating or not, go and knock. Why? Because you cannot store sperm. Sperm is not for storing. Sperm is for continuous release, right? 3 times a week, knock waiting no good, right? If it's not your window period, the knocking will nourish you as a woman. To nourish you, go fresh, get energy, join. If it's in your window period, possibility of pregnancy, and that's what we want, right? So what did we say? Go and knock. Stop looking at me like that, as if you don't know what they talk. And by the way, if you are less than 18 years old, get out of here. This live stream is not for you. Anyway, let's continue our gist. You never knock for 2 years. Who be that person? We need to organize a special retreat for your case. Oh boy. Oh boy. But it is what it is. The easiest way to become pregnant is to knock. All right. So let's continue. You see, there are other hidden truths about egg counts, right? Right. Yes, hidden truths. Because having a high egg count still does not guarantee that you are ovulating regularly. It's not a guarantee. It's not a guarantee that the eggs are of good quality. Martha is here. And it's not also going to guarantee successful pregnancy. Right? It won't. And this is especially important in conditions like PCOS. Right? Now, the question has always been why some women with good results, why is that they struggle too? Why? Good result, but they struggle. If you are just joining, you're welcome. Follow me, tap on your screen, share the live. If you miss anything at all, go to YouTube. Dr. Godwin EMB is the name. A lot of things for you to learn. if you are trying to conceive. And make sure you subscribe to me. Thank you. So why some women with good results? You have tested. The results are good, but they are still struggling. Conception is still a matter. It's still a matter. Why? Because a woman can be told that your AMH is good. That's what we're looking for, right? AMH is good. Your ovaries looks fine after ultrasound. Yes. Yet pregnancy does not happen. Why? There are many other things. There are other things, which the most important one is egg quality. Egg quality. It is not just the quantity that matters. Quality also will determine the outcome. Right? So somebody asked the question one time on the comment section. That's why I said, stay till the end, you will learn. Somebody asked the question, can egg quality be improved? I told you it's a very good question. Can egg quality be improved? This is a complex question. Why? Because I will get to your Adasa. Your own is for Q&A. We'll get to your own. I know. We'll get to your question. All right. So I said it's a complex question because egg quality is influenced by age. Right? Influenced by age. But again, there are some factors that can optimize it. Is that okay? And something like lifestyle improvements like balanced nutrition is one of those things that can optimize egg quality. Why age is doing its thing. For example, you have an old vehicle, right? But it is well serviced. You go walk, abi you no go walk. It may not outperform new vehicles, but it will work, right? So lifestyle improvements will help, and one of those improvements is balanced nutrition. While I know a lot of people are rushing so hard. I want to take supplements. Calm down with your supplements. Calm down, right? Can you not eat good food? Can you not have good nutrition? The word is supplement for a reason, right? Supplement for a reason. Supplement means you want to supplement what is not adequate. But if you cook good food, will you not have these nutrients that you are going to buy? Because some people, one time, and I will never forget that individual. They came to my DM for consultation, and I said all the wonderful things I need to say, and I thought I've done something good. I said, okay, see you later. He said, what? See you later to where? Won't you tell me drugs to take? Why? Because in the mind of the average individual, until you give them drugs, you've not done anything for them. But that is not medicine. And that is why they are exploiting you. It has to be very necessary. It has to be very necessary. Right? Many of such times, the very drugs that you are taking may just be the cause of the problem. You are rushing to take supplements. Hope you know that you cannot take too much supplements. Get out of here. Anyway, where was I? I was talking about how to optimize egg quality. And I talk about balanced nutrition. Right? Is that Go-Go? Go-Go is here. Hello, Go-Go. Good to see you. Also, avoid toxins. Toxins is everywhere. In your environment especially. Food preservatives. Some of these chemicals you drink, you call it juice or beverage, whatever they call those things. Right? The one you put to smell nice. Put on your skin to look good. Read the ingredients that these things are made of. Read it and help yourself. I will stop there because TikTok don't like me talking about this thing. Before you know, the number of viewership will just drop. Woo! Because they don't talk about it. So that is avoid toxins. There is also the aspect of good sleep. You, why you don't want sleep? You be winch. Why you don't want sleep? What constitutes good sleep? First of all, the sleep must be consistent. The sleep must be nothing less than 7 hours, 7 to 8 hours. Right? Consistently. You pick a time from 11 o'clock, I'm going straight to bed. Do that for the next 3 months and see whether you know go carry belly. Because you are looking for drugs. Get out of my face. I will not talk. Continue. When you are ready, then we will now walk your journey together with you. I told you, all the people that have testified to be positive for pregnancy this year, we didn't give them one drug. Stop deceiving yourself. But if your case needs medication, we will direct you. If your case needs assisted reproductive technology, we will direct you. But majority of the people don't need nothing. All they need is to listen to what I'm saying. And one of the things I'm saying tonight is sleep. Sleep. Lie down, sleep. Close your eye. Sleep. They no swear for you, may your eye be open. Martha is here. So I'm going to ask you, when are you going to start sleeping? This is the day and time of AI age, remote jobs and all those things, even live streaming. You spend all night awake, doing what? Watching videos, Netflix. People that acted it, they don't knock born pikin. You are watching. And you are trying to conceive. When are you going to start sleeping? You're trying to conceive. You are watching people's video on TikTok all through the night. Or you are doing remote jobs. Now night because we wish. Right? When are you going to start sleeping? I can always guarantee you, if you would sleep consistently for the next 3 to 6 months, you see what? Why? Because when you do what you do all through the day, cortisol goes up. I'll come back to that 19, right? But they are not exempted anyway. When you do what you do during the day, cortisol goes up. All right, and cortisol is a stress hormone. It's the body's way to cope with stress. And as cortisol goes up, if cortisol remains up perpetually, because you know agree sleep, because you wish. Right? If it remains up perpetually, it suppresses and begin to affect reproductive function. That alone is a problem. Right? But when you sleep, what happens to you, especially sleeping night time in the dark? What happened to you? I tell you, sleeping is housekeeping time for the body. Your body goes ahead to take out dead cells, weak cells, cells that are beginning to go wayward, what you want to call cancer cells. Take them all out. Toxins, you pull out all the toxins while you are asleep. Right? It does that. Then after taking out all the dead cells and toxin, it goes around to recalibrate your hormonal function. And sleeping in the dark is so important that you know that guy they call melatonin is a hormone. Melatonin goes up while you enjoy good sleep. Goes up. And what does melatonin do to your eggs? They protect them to make sure damage does not come from these free radicals that is looking for what to destroy the body. That's what it does. So when are you going to sleep? I'm asking these 50 plus people here, when are you going to start sleeping? If you have to put your device on timer, right? On timer. Including men, not just women, including men, because men have to produce precious sperm. And the only way to produce precious sperm is when you are healthy and have good quality lifestyle. So when are you going to sleep? Right? This one you are looking at me with your two eyes like this. So sleep. Because that one is in your hands. It's in your hands. Diet is in your hands. Sleep is in your hands. Avoid toxins, yes. But one way or the other, it gets to you. But do your best. Now, the Oga Patapata of them all. Good evening to Last. To Last is here. The Oga Patapata of them all is stress reduction. We're talking about how you can optimize your egg quality. If you missed anything, make sure you watch this video on YouTube tomorrow. You're so late. Don't worry, the video will be on YouTube. Go to YouTube, make sure you subscribe to me. When I hit 1K subscribers, I will start going live there too. Linda, I've got something coming up that will solve that problem. Don't worry. All right. So now the last one I want to talk about, to optimize your egg quality, stress reduction. Why are you so stressed? Emotional stress, psychological stress, physical stress. You're so stressed out. I hope you know it's going to affect your fertility. It does. So manage your stress, whether you're a man or a woman anyway. But because we're talking about women, so I'm focused on women. Manage your stress, right? And of course, somebody told me that Oga is my partner that's even stressing me the more. So guys, stop stressing them. Stop stressing so that their egg go get quality. Stop stressing them. Right? Miss Digit Official, you're welcome. You're welcome. Stress, manage your stress. Right? According to Adasa, there is financial stress, there is man stress, right? So, let us take care of the man stress. Okay, so these are the things you can do to optimize your egg quality. All right, optimize it. You can also have antioxidant support. It helps to reduce oxidative stress. Remember what I said about oxidative stress. So make sure you eat quality diets rich in antioxidants. It's going to help you, right? Now there is the there is the time factor with respect to egg quality. Good evening, that nonchalant girl. I see you. You're welcome. Now look at this. Since egg take time to mature, right? Improvements in the egg quality may take time to reflect. For example, if you change your behavior today, the reflection on your egg quality may be in 3 months' time. You understand? So don't just come and say, okay, I've done this for 2 weeks, I'm looking for result. No, it doesn't work like that. Because of maturation time, right? Some good stuff I told men too. So women, this is your own. Right? So change your attitude today. Start sleeping today. Start managing your stress today. Start eating quality diet today. Stop running all over the place looking for drugs. Drugs is good if it's necessary. But the first thing to look out for in your fertility journey is not drugs. It's what I'm telling you now. Right? Fertility is not just a game of numbers. It is a quality game. It's not how many eggs. It's how many of those eggs are actually quality eggs. Right? Because in the end, one healthy egg at the right time, in the right environment, is more powerful than many eggs that cannot complete the journey. It will shock you. That's how simple fertility can be. Let's answer questions.